Good afternoon and welcome to the Public Safety Coordinating Council meeting Friday, September 29th at 2 p.m. If you would all rise and say the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I appreciate all of you being here today. We've kind of changed it up a little bit. As you know, we usually meet in the jury assembly room. I thought today, but with having it here, we can record the meetings. It just makes for a better venue. But we're also going to have a panelist today, so I'm going to trade seats. I'm going to invite the panelists to come up here and sit. We're going to have some input from the public, let everybody do their reports as we normally do, and then kind of jump into the program. So I hope you find it informational. If you have questions, please come to the podium and ask them or put your input in. And that's how we're going to resolve where we're headed in the future with mental health and substance abuse in our county. It's a big challenge, not only for Citrus County, but for across our globe. We see it every day when we turn the TV on. So I hope that we can make some strides in making Citrus County a better place to live and call home for our residents. Thank you so much for being here. Panel members? Yeah, we'll let them take their seat.
Who we missing? Danny's here. Johnny's here. Joe, that's who we're missing, is Joe. She's not here yet. Rebecca, we're worn down on the panel, but. Okay, we'll go ahead and go with the, vote. Okay, just start the meeting off. We're gonna have member updates, and we'll start with the court alternative program. Kelly Kell.
Good afternoon. I'm Kelly Kell, the Court Alternatives Program Supervisor for Citrus County. For those of you that may not know what that means, I supervise mental health court, drug court, teen court, and veterans treatment court. I did provide updates that were on the table in the back, so if you picked one up, you can refer to that. But right now, currently in our felony drug court program, we have a total of 12 clients with 2 pending. And we ran some statistics a few weeks ago. Since 2018, the percent of our graduates that have reoffended is only 17.6%. So those are people that go through the entire program, complete it successfully. Only 17.6% of them have reoffended. In our dependency drug court, which is our cases that involve DCF, we have 6 current clients with 1 pending, and since 2018, our percent of graduates that have had a new dependency case open is 20%. In our mental health court, we currently have 7 clients with 3 pending, and since 2018, only 18.7% of our graduates have reoffended. Veterans treatment court, we have 4 current clients with 2 pending, and since 2018, 15% of those graduates have reoffended. In teen court, we currently have 77 clients with 23 pending, and from 2018 to 2022, we had 710 teens that were referred to the program. 587 of those entered the program. Of the 587 that entered the program, 477 successfully completed, and that's an 81.3% success rate.
Okay,
That's all I got.
we'll take questions, or we just have reports? Just reports. Looks like there is a question, but we're not allowed to take questions. So, so next, Citrus County School Board, presented by Dave Vincent.
Is it all right if I talk from here? That's pretty good, because I've been bad on losing my voice all week, so it's probably good. All right, maybe I'll do it like this. How about that? All right. All right, good afternoon, everybody. Dave Vincent, Citrus County School District. So I just wanted to go over some of our statistics from the 22-23 year, and I'll give you a little bit about what we've seen so far this year as it relates to what we're seeing as far as suicide risk assessments and then also behavioral threat assessments that we do at our school district. So for 22-23, our suicide risk assessments, and this just encompasses threats to self. We did 381 suicide risk assessments last year. Our behavioral threat assessments, and that is everything outside of suicide risk assessments, and that's threat to harm others. We did 465 of those, and we had 21 Baker Acts on campus. So new this year for the 23-24 so far, we've done 39 suicide risk assessments, 60 behavioral threat assessments, and so far we have done 11 on-campus Baker Acts. So that's a little bit high. As you know, we had 21 total on campus last year, so we're already trending at more than half of that already, and we've got obviously several months to go before our Christmas break is kind of our halfway point. So the one thing that I did want to highlight that a lot of people don't know about because it is relatively new, I know a lot of people in the audience know Rachel Montgomery, but she's a new addition for us at the school district. And this year, our legislature enacted part of the school safety bill was a behavioral threat management model specific to the state of Florida. So every school district in the state of Florida now has to have a designated person that handles threat management. And that's typically threat to harm others, but in our world, the threat to harm others and threat to harm self tend to overlap sometimes. So Rachel joined our team about a month ago, and she has jumped right in to get the training provided to our staff. We have to have 167 staff members trained by December 31st on the new threat management model from the state of Florida, the Department of Education. So she's got a big task in front of her to get all of that done. But what that really looks like for us in school is really how do we manage services for our students, because the new model, the thing that we do like about it, and it's for the same in behavioral threat management and suicide risk assessment, is that early intervention. So the new Florida model is really aimed at that prevention piece. So when someone sees a student in our schools that start exhibiting some of those things that we call risk factors, they become isolated, staying away from friends, their grades start dropping. Those are when we want to start interventions and start trying to identify those things, not to when it gets to the threat level, to where we're actually dealing with threats to harm others. So I'm really excited about the model. I think it's going to help us focus in on the students that really need those services. And we're really blessed to have Rachel on our team with that because of how intertwined she has been in our community with behavioral health. So that's a new model for us in the state, but we're doing a really good job of it here in Citrus County. So look forward to the things coming out of that and what we have to come for that. So does anybody have any questions for me on any of that? Yes, ma'am.
Do you happen to know, by any chance, why the NAMI Ending the Silence program isn't allowed in schools yet?
That's not my area, no, ma'am. Yeah, that would be curriculum. Anything else? Thank you.
Okay, next report, Florida Department of Health Opioid Task Force, presented by Todd Hockert.
Good afternoon, everyone. I'm Todd Hoggart with the Florida Department of Health. I work under the Overdose Dated Action Grant, which we call OD2A. And part of that grant was to establish a task force within our community that looks, initially it was just opioids, but we know that that's not just the case anymore. So we look at all substances. So what I'd like to do is just give you a brief little bit of information on that. And I promise I won't bore you with any statistics, although I do have one at the end. So we were established in January 2021 as, like I said, as part of that grant. We currently have over 65 agencies that are part of our group, and that's agencies in behavioral health and substance use disorder, along with citizens. And what we like is citizens with lived experience, because they can bring information back to the group that some of us don't normally have. So that's what we really look for. There is no criteria to join. You just send me an email and I add you to the group. So we encourage a sharing of information. And when I got into the position, one of the big problems was where to find information, and nobody was really willing to share it at that time. So we've made a little bit of headway. We do have data available to us, and that's what we go over during our monthly meetings. But still, the behavioral health sector is really sort of a data wasteland or desert, because we don't have that information. So we're trying real hard to get that information, and being part of this group really helps with that. So we do have our own established goals and action plans to help reduce the number of overdose fatalities in the county. That's our #1 mission, is to reduce deaths. Collectively, over the last 2 years, we've given out over 1,300 doses of Narcan. A lot of that went to when the health department was initially able to give it out, but the Citrus County Sheriff's Office was really the only proactive group prior to that was handing out Narcan for free. We share with members all the educational opportunities out there, any trends in research. You'll start hearing things probably about xylazine or tranq. Our group talked about that about 4 months ago. So we're really on the cutting edge of what we're seeing on the streets, and we bring that to our members as so they're aware. And we do represent on a regional group, Live Tampa Bay, which is formerly Project Opioid Tampa Bay. So we get information from that area, and they do a lot of business and faith-based groups down there, so it's really helpful to have that. And the only statistic I'll give you is year-to-date, we've had 38 deaths in the county. Last year total, we had 72, so unless things really go bad, we should be under that number this year, so that's always a good thing.
Thank you. Next, the warden's report. Warden Orlando Rodriguez. Core Civic.
Good afternoon, everybody. There's copies of this report are in the front as you enter, so if you want to take a copy with you, you're free to do so. I'm going to try to summarize this report because we're going to report as well on inmate programming, and we have our programs coordinator here for that. But before I start, I want to introduce to you Mr. Carlos Melendez. Carlos is in the audience. He used to be the warden at the Citrus County Detention Facility from 2000 to 2007, and now works for Partnership Department at our corporate office in Nashville. So, like I said, I'm not going to break down all the information, but I'm going to be probably better summarizing everything. Booking processing fees that we have collected and returned to the county year to date, $29,162.99. There's a $20 booking fee for every inmate we receive. Definitely not all of them come with money, but those who do, we charge this booking fee. Total revenue share with the county, because we house two other populations. We house United States Virgin Island inmates, and we house United States Marshal Service inmates. So we have returned to the county as of today $43,767.82 for the U.S. Marshal Service inmates. And from the U.S. Virgin Islands, we have returned to the county $56,927.26 for a total of $100,695.08. Inmate programs resulting in cost savings for county due to sentence reductions. Total number of days reduced, 60 days. Total cost savings, $4,280. Social Security incentive payment. And this is payment payment is for notifying the state when a person is incarcerated and Social Security is stopped. We have 0 for this year. So how many inmates we have intake and release this year? So as year to date, as of the end of September, we have received or intake 2,978 inmates. And we have released 3,023. So we have released more inmates than we actually intake. How this breaks down, 2002 is males, 776 is females as far as intakes, 2,226 for males releases, and 797 female releases. As far as a projection or a breakdown of what a representation of the county inmates we house, the average length of stay is 59 days. Sex offender in custody, we have 19. Juvenile in custody, this is 7. Marchment, 6. And special need inmates is 35. When we mention special needs, this is mental health inmates that are under the care of the jail. And I think this is a reflection of the problem that probably we'll be discussing today as far as our mental health issues in the county. Daily average count report, as of this morning, we have 624 inmates in custody. 466 are Citrus County inmates, 76 are Marshal Service inmates, and 82 are U.S. Virgin Island inmates. And inmates that we house that have prior military history or service, we have a total of 8. Capital and physical improvements funded for 2023, we have 0. And now with inmate programs, unless there's any questions for me, I'll leave you with our programs coordinator, Mr. Hoyk.
Good afternoon. Come to report that NA has started up at last meeting and all that. We fired up the NA group, which is a Narcotics Anonymous group. Last month, we had 54 assigned to go, 42 attended. This month, we increased to 95 assigned with 67 attended. So we're looking to also to build up the Narcotics Anonymous in our facility. Right now, they're only running every other week classes and sessions with it. And then they have to complete 5 sessions, a certificate to get completion of that program. AA is last month was 88 assigned, 66 attended. Stepped that up this month for 103 assigned and 68 attended with certificates issued from both ends. So we stepped up also on both the programs that assist with the facility. Out in the vestibule also, you will find a brochure with all of our programs listing in it. Right now we are capable of running up to 25 programs into our facility. And they say, well, that's not much. But you got to think of the 25, we got to do juveniles, females, males, Virgin Islands, U.S. Marshals, and they are all broken down in different categories, not only because of keep separates and all of that they can't do to be together with, but also with juveniles. That's a real extreme program that people that deal with them know what I'm talking about, that we have to almost go one-on-one training with them. As of right now, the Go Further program and Hustle 2.0 are reentry programs. It's included in the brochure, the informations of it. I've been requested for some info on that. It is also in this brochure about it. Vocational programs people are all asking for. We do TPC. TPC is a vocational type program. We handle it mostly for all the workers and types in the facility, which is 120 mandated workers that we have on staff running in the program right now, which is subsidized by the county for time off relationship. All right, that's 120 per day, and it fluctuates every day. So with doing all of that with the TCP program, we go into vocational standards from anywhere from floor cleaning to painting to restroom cleaning and all of that stuff, and that's what we mandate on. What they do in the facility is what we'll be looking at to put out in the street to you for working operations. And especially with the buildings going on now in the county, a lot of that's going to be a lot of maintenance of buildings and all of that for not only for Target and all the other stores and all of that, that would give them something to look at and come into to utilize when they get out. And TPC is a certified course program for all vocational. GED program, we run the full GED from cabing to supporting actions up to building and to help them throughout all the forced processings of the GED program. Education programs, Pearson is our runner for that right now. We are having some problems with some internet access towards our facility. Everybody, if the school district knows what I'm talking about, they just updated most of all their computer systems and all for this reason. And we'll be working on that hopefully within the next year when budgets occur. Any questions of me? Yes, ma'am.
Can you clarify, you know, when you were talking about like the NA program and you said this many are assigned, but this many attend?
Right.
How does that work exactly?
We can't mandate drag them to class. It's just like the school district, you know, they're a little bit better. A lot of people will sign up for it and see who attends it and what they get out of it. And as you can see from month to month, the more it gets rolling, the bigger the increases starts. That's how it works at our facility. We can't mandate them. It's just like a juvenile. We can't go and drag them to a classroom. We mandate our policies with our company is that all juveniles in the facilities will be in the GED, and we work with the Citrus County School Board on it, if they're a member with the school board and all that, to coordinate with them and all of that, to put them into the GED program to keep them rolling. But we can't mandate and drag them. Even a lot of people think we can, we can't. Anything else? Anybody else? Thank you very much.
Okay, thank you. Individual testimonies, this are open to the public, Rebecca? Is that how we work that? Okay, individual testimonies. If anyone wants to come up and address the group, now's the time. Come on up. Just stand up there, tell us your name and,
My name is John Cobb. I am 15 years old, and I find it very important what is being done in this meeting. I wanted to say thank you, but I also wanted to say, as a member of this community, there are still things that need to be done. Now, mental health is getting a lot more attention than it used to, and a lot more people are realizing how much it can relate to crime, drug use, abuse, because the brain is kind of the root of all of this, but something in mental health that isn't as well addressed, and I think a lot of people want it to be addressed but don't know how, is mental health in youth. It's a very touchy subject, trying to address that in young people, with most mental illnesses developing around age 14, but not really enough research into how to take care of it when it starts. It makes it very difficult. I've been through many programs. I've been in support groups. I've been in long-term facilities, and I've been in Baker Acts. And I all see what they're trying to accomplish, some more in some fields than others, some less in some fields. But there just isn't enough support. There isn't enough backing. I remember looking for a youth support group, and the closest one I could find was in Hernando. Even looking for normal support groups, mainly focused around adults, it was hard to find. I had to go into just every little corner of the internet, obscure little websites to find these groups that were right next door. It's such an important thing, but what we need to do now is find out a way to truly advertise it and make it public, to make it known. Because even if those resources are there, there's no point in them being there if nobody knows about it. For instance, I started my own support group with NAMI, and NAMI has helped me and my group so much. But getting it out to the rest of the community is the problem. We need more community outreach, advertisement, sponsorship, whatever it takes. Because these groups, whatever they are, NA, CA, just normal support groups, youth, adult, they save lives. They save lives every day. But we just need the outreach. And none of us can do it alone. I don't really know much of what to say, but I wanted to say what was on my mind to maybe get the ball rolling, because I see that all of you are trying, and all of you are trying to do something very important. We all are. But I just wanted to say we all need to keep pushing, because no matter what, it will never be enough, and that's okay. We just need to keep adapting and keep changing. And we can, day by day, make Citrus County, Florida, the U.S., a more beautiful and more accepting place. It takes work. It takes hard work. So I just wanted to say thank you, and I look forward to working with any of you.
Thank you. Maybe he should be sitting here, I don't know. That was very powerful. I'm not sure who wants to follow that. George.
Good afternoon, everyone. I know John. I helped mentor John. I'm proud of you, John, for sure. Hey, I just want to say something. I feel like this is just for the good of the order. I want everyone to know that right now in our community, at United Way, I'm United Way CEO, George Schmalstig, by the way. Good to see so many of my friends here and colleagues. Right now, we're sheltering 44 people in hotels that were impacted by the storm. And, you know, the last time I was in here in BOCC chambers and mentioned that, the final point that I made is that when people are displaced, particularly from subsidized housing, all manner of issues come to the forefront, right? We see our housing crisis right in front of our faces. We're so excited when 18 units opened up behind Daystar, Catholic Charities, Catholic Diocese of St. Pete. Remember the excitement in the newspaper and everything? Madeline and I went on 5th Street in Crystal River, and in a matter of a day,